morning, everyone. Today I will talk about a topic is new discovery of medicine, Chinese medicine for anti-lung cancer. My name is Ng. You can call me Candice. Here is the presentation outline. Firstly, I will talk about lung cancer problem nowadays, and then the formation of lung cancer. And after that, I will talk about the herbs helping anti-cancer, lung cancer, and then the conclusion. Okay, let's see. Lung cancer is one of the major killer in the world. Only less than 15% patients have longer term survival. What does it mean, longer terms? Okay, I tell you here. Longer term, that means greater than 5 years after the initial diagnosis. That means more than 85% of patients will be dead within 5 years. So it is very serious. Let's see. Let's look at Hong Kong situation. You can see that for men, it is the first killer is the lung cancer here. Okay, it is the case and will be dead in lung cancer. And then it is female. For lung cancer, it is also the first killer of lung cancer. The common one is the breast cancer, but the most killer, the first killer is lung cancer. However, about reason, we can know that we need to know more about lung cancer. However, there are some problem also existing. It is because nowadays drug is not have not changed sustainably, and then some drug already have some via lung cancer cell already have some resistance for this nowadays drug. So we need to develop some new and some anti-cancer drug for anti-lung cancer. Did you have a healthy lung? Maybe your lung will not like this, right? It is a kind of lung cancer. This picture is stolen, so I hope you do not have this kind of lung. So let's see how the lung cancer forms.
The lungs are the primary organ in respiration. They are sponge-like organs that are divided into lobes. Although the right lung has 3 lobes, the left lung has only 2 lobes due to the position of the heart, which is toward the left side of the body. During respiration, air travels through the nose, down the trachea or windpipe, and into the bronchus. The bronchus branches into narrower bronchioles and then into smaller and smaller airways, ending in air sacs called alveoli. It is at the alveoli that oxygen is exchanged for carbon dioxide. Most cancerous changes occur in lungs long before any symptoms are present. There are many types of lung cancer, but the most common lung cancer is bronchogenic carcinoma, which begins as a tumor in the lining of the bronchi. Lung cancer can also be present in the trachea, the bronchioles, or the alveoli. Lung cancer is the leading cause of cancer deaths among men and women. But the most alarming news is that more women will die from lung cancer than will die from breast cancer. Cigarette smoking poses the greatest risk for developing lung cancer.
Okay, maybe all of you know about more about lung cancer. Let's see the factors of causing lung cancer. It is some uncontrolled cell growth in tissue of the lung. It may lead to metastasis. What does it mean, metastasis? That means like this one. You can see here, metastasis. Some destroy of the tissue. And I have met in the video it has mentioned before there are many kinds of lung cancer. I separate them into two types. The first one is small cell lung cancer, and then it's the tumor with the tumor, and then the next one is non-small cell lung cancer. Okay, let's see. I will focus on the top one, this one. Okay. In the studies, we can find that there are about five herbs we can go to study here. I have grouped them in similar way. Okay, there are some similar studies here. You can see all of the herbs, they will extract the herbs firstly, and then it will oral intake by the mouse, such as the mouse with lung cancer tumor, and then the mouse with, it is healthy lungs, and then see whether for the mouse with lung cancer tumor, let's see is there any significant effects produced, and then for the lung in the mouse, we see when it after intake the extract herbs, see is there any harmful produced in their body. So let's see if these herbs have any side effects. I have separated the herbs into 3 groups. It is the first group here. It is these 2 types of herbs. They have a similar function of anti-lung cancer. They can induce this one and help to reduce the resistance of some drug, which the drug also can induce this one. This one is autopotus. Autopotus is a form of the deaf cell. It is one major concern in the cancer therapy. So the tumor also will be eliminated when this one apoptosis. Apoptosis growth, the tumor cell will be eliminated. So let's see this triangle relationship. This one, the herbs I have mentioned before, and then it will induce this one in our body, and then it will reduce. This one can reduce the tumor. And it is similar. This one is similar to the last one. And this drug can induce this one. Also, this one can reduce that one, right? And then, however, but this drug, the cancer cell has some resistance. So we need this one to reduce the resistance. Is it clear? Clear. Okay, I have grouped, these are the other groups. This one and panchilin, and they also can reduce the tumor, so I grouped them together. And this one is a kind of prevention. So I didn't talk more about that. It's just a prevention, not just anti-cancer, but it can prevent it. Okay, for conclusion, herbs have significant effects for anti-cancer. But however, we need to take further study on it. Also, I want to promote that treasure our environment for more new findings. Yes, this is my reference. Thank you. Yes. That's the end. Question. Yes, hello. Question.
Do you think the existing therapy of the lung cancer is effective?
Sorry, can you repeat?
Do you think the existing therapy for lung cancer is effective for all patients?
No. So we need to find out more new one. Yeah. It is because some resistance. The lung cancer cell has some resistance for nowadays drug.